Question 1. A 45-year-old patient presents to the outpatient clinic with complaints of chest pain and shortness of breath. The physician performs a detailed history and examination and medical decision-making of moderate complexity. The total time spent on the encounter is 40 minutes, which CPT code best represents this evaluation and management (EM) service. A. 99,203. B. 99,204. C. 99,214. D. 99,215. Correct answer, C. 99,214. Explanation. According to the 2021 EM Guidelines, Code 99,214 corresponds to an established patient visit with moderate complexity MDM, or 39 minutes of total time. Since the total time is 40 minutes, which exceeds the typical time for 99,214, but does not meet the threshold for 99,215, which requires 54 minutes, 99,214 is appropriate. Question 2. A patient undergoes a colonoscopy with removal of a polyp using hot biopsy forceps. Which CPT code should be reported for this procedure? A. 45,384. B. 45,385. C. 45,383. D. 45,380. Correct answer, A. 45,384. Explanation. CPT code 45,384 describes a colonoscopy with removal of tumor S, polyp S, or other lesion S by hot biopsy forceps or bipolar cautery. Code 45,385 is for removal by snare technique, 45,383 is for ablation, and 45,380 is for biopsy. Question 3. Scenario: Mr. Thompson presents to the outpatient clinic for a scheduled excision of a 2.5 cm benign lesion on his right forearm. The procedure involves layered closure. The physician also removes a 1 cm benign lesion from the left shoulder without closure. How should this be coded? A. 11,403, 11,459. B. 11,403, 11,400. C. 11,451, 11,400. D. 11,403, 11,451. Correct answer, A. 11,403, 11,459. Explanation. CPT code 11,403 is for excision of benign lesion, 2.1 to 3 cm, with layered closure. Code 11,400 is for excision of benign lesion, 0.5 cm or less, without closure. Modifier -59 is used to indicate that the second procedure is distinct and separate from the first. Question 4. A physician performs a diagnostic sigmoidoscopy and decides to convert it into a therapeutic procedure by removing a polyp using snare technique. Which CPT code S should be reported? A. 45,330. B. 45,331. C. 45,333. D. 45,338. Correct answer, D. 45,338. Explanation. CPT code 45,338 describes a sigmoidoscopy with removal of tumor S, polyp S, or other lesion S, by snare technique. Diagnostic procedures are included in therapeutic procedures and should not be reported separately. Question 5. A patient receives a series of 3 intramuscular injections of penicillin G-benzathine for treatment of syphilis. How should this be coded? A. 96,372 x3. B. 90,471 x3. C. 96,372, 96,372 76 x2. D. 96,372, 96,372 59 x2. Correct answer. C. 96,372, 96,372 76 x2. Explanation. CPT code 96,372 is for therapeutic, prophylactic, or diagnostic injection, specify substance or drug, subcutaneous or intramuscular. Modifier -76 indicates a repeat procedure by the same provider. Therefore, the first injection is coded as 96,372, and the subsequent two injections are coded as 96,372 76. Question 6. Scenario: Ms. Garcia undergoes a laparoscopic cholecystectomy. During the procedure, the surgeon decides to convert to an open cholecystectomy due to complications. How should this be coded? A. 47,562. B. 47,600. C. 47,562, 47,600. D. 47,600 with modifier. Correct answer. D. 47,600 with modifier. Explanation. When a laparoscopic procedure is converted to an open procedure, only the open procedure is reported. Modifier is added to indicate increased procedural services due to the conversion. Question 7. A patient receives a flu vaccine administered intramuscularly. Which CPT code, S, should be reported? A. 90,658. B. 90,658, 90,471. C. 90,658, 96,372. D. 90,658, 90,460. Correct answer. B. 90,658, 90,471. Explanation. CPT code 90,658 is for influenza virus vaccine. Code 90,471 is for immunization administration, percutaneous, intradermal, subcutaneous, or intramuscular injections. One vaccine. Therefore, both codes should be reported. Question 8. A physician performs a diagnostic thoracentesis. Which CPT code should be used? A. 32,421. B. 32,554. C. 32,555. D. 32,422. Correct answer. B. 32,554. Explanation. CPT code 32,554 is for thoracentesis, needle or catheter, aspiration of the pleural space, without imaging guidance. Code 32,555 is with imaging guidance. Question 9. Scenario: Mr. Lee presents for removal of a 3.5 cm malignant skin lesion on his back. The excision includes margins, and the wound is closed with complex closure. How should this be coded? A. 11,606. B. 11,606, 13,102. C. 11,606, 13,102 D. 11,606, 13,102 Correct answer. B. 11,606, 13,102. Explanation. CPT code 11,606 is for excision of malignant skin lesion, 3.1 to 4 cm. Code 13,102 is for complex repair of the trunk, 2.6 to 7.5 cm. Both codes should be reported as the closure is more than simple. Question 10. A patient undergoes a screening colonoscopy, during which a polyp is found and removed using cold biopsy forceps. How should this be coded? A. 45,378. B. 45,380. C. 45,378. 45,380. D. 45,380 with modifier PT. Correct answer, D. 45,380 with modifier PT. Explanation. When a screening colonoscopy becomes therapeutic, the appropriate therapeutic code is reported with modifier PT to indicate that the procedure began as a screening. Question 11. A patient presents with chest pain and is diagnosed with unstable angina. Which ICD-10-CM code should be assigned? A. I-20, B. I-21, C. I-29, D. I-25119. Correct answer, A. I-20. Explanation. ICD-10-CM code I-20 is for unstable angina. Code I-21 is for angina pectoris with documented spasm. I-29 is for unspecified angina, and I-25119 is for atherosclerotic heart disease with angina pectoris. Question 12. A patient is diagnosed with type 2 diabetes mellitus with diabetic nephropathy. Which ICD-10-CM code, S, should be assigned? A. E1121, B. E1122, C. E1129, D. E119. Correct answer, A. E1121. Explanation. ICD-10-CM code E1121 is for type 2 diabetes mellitus with diabetic nephropathy. Code E1122 is with diabetic chronic kidney disease. E1129 is with other diabetic kidney complication, and E119 is without complications. Question 13. Scenario. Ms. Johnson presents with a history of breast cancer, currently in remission. She is undergoing routine follow-up. What ICD-10-CM code should be reported? A. C5919, B. Z853, C. Z08, D. Z83. Correct answer, B. Z853. Explanation. ICD-10-CM code Z853 is for personal history of malignant neoplasm of breast. Code C5919 is for current breast cancer. Z08 is for follow-up examination after treatment for malignant neoplasm, and Z83 is for family history. Question 14. A patient presents with acute bronchitis due to Mycoplasma pneumoniae. Which ICD-10-CM code should be assigned? A. J20, B. J28, C. J29, D. J157. Correct answer, A. J20. Explanation. ICD-10-CM code J20 is for acute bronchitis due to Mycoplasma pneumoniae. Code J28 is for acute bronchitis due to other specified organisms. J29 is for unspecified, and J157 is for pneumonia due to Mycoplasma pneumoniae. Question 15. A 67-year-old male patient presents with fatigue, pallor, and shortness of breath. After evaluation, the physician documents iron deficiency anemia due to chronic blood loss from gastrointestinal bleeding secondary to a colonic angiodysplasia. Which is the most appropriate ICD-10-CM coding for this encounter? A. D59, K92-2, B. D50, K5520, C. D62, K5521, D. D50, K3189. Correct answer, B. D50, K5520. Explanation. D50 is the ICD-10-CM code for iron deficiency anemia secondary to chronic blood loss, which is explicitly stated in the scenario. K5520 refers to angiodysplasia of the colon without hemorrhage, which represents the underlying GI cause of the chronic bleeding that led to the anemia. Correct coding emphasizes specificity and linkage between anemia and the causative pathology, aligning with ICD-10-CM official guidelines for coding and reporting, Section IC2E, on anemia in chronic diseases. Question 16. A patient presents for a screening colonoscopy. During the procedure, diverticulosis of the sigmoid colon is found incidentally, without any signs of inflammation or bleeding, which ICD-10-CM code should be reported. A. Z1211, K5730. B. Z1211, K5732. C. K5730 only. D. Z1211 only. Correct answer: A. Z1211, K5730. Explanation: Z1211 is used for screening for malignant neoplasm of the colon. K5730 is the code for diverticulosis of the large intestine without perforation or abscess, without bleeding. According to the ICD-10-CM guidelines, incidental findings during screening are reported as secondary diagnoses. Primary diagnosis should reflect the reason for the encounter screening. Question 17. A patient is seen for management of hypertension and type 2 diabetes mellitus with diabetic peripheral angiopathy without gangrene. Which combination of ICD-10-CM codes should be reported? A. I10, E119. B. I10, E1151. C. I119, E1140. D. I10, E1151, I739. Correct answer: B. I10, E1151. Explanation: I10 is essential hypertension. E1151 is for type 2 diabetes mellitus with diabetic peripheral angiopathy without gangrene. I739, peripheral vascular disease, unspecified, is not needed because the complication is already captured under E1151. Per ICD-10-CM guidelines IC4A6, complications of diabetes should be coded using combination codes where applicable. Question 18. Mr. Edwards is a 76-year-old male undergoing a routine follow-up for prostate cancer, which is currently under control. He is not receiving active treatment. The provider documents history of prostate cancer, status post-prostatectomy. What ICD-10-CM code, S, should be reported? A. C61. B. Z8546. C. Z08. D. Z1503. Correct answer: B. Z8546. Explanation: Z8546 indicates a personal history of malignant neoplasm of prostate. C61 would be used if cancer was active. According to ICD-10-CM section IC2I, a code from the Z85 category should be used for patients with past history of cancer who are no longer undergoing treatment. Question 19. Which HCPCS level II code represents a walker with adjustable height and wheels? A. E143. B. E141. C. E147. D. E135. Correct answer: A. E143. Explanation: E143 is defined as a walker, folding, wheeled, adjustable, or fixed height. E141 is for a rigid-wheeled walker. E147 is for a walker with enclosed frame platform walker. E135 is a non-wheeled walker. Question 20. What is the correct HCPCS code for injection of epwedin alpha, 1,000 units, for non-dialysis patients? A. J885, B. J881, C. J882, D. J883. Correct answer, A. J885. Explanation: J885 is the correct HCPCS code for epwedin alpha, non-ESRD use, per 1,000 units. J881 is epwedin alpha for ESRD on dialysis. HCPCS guidelines require that ESRD and non-ESRD use be differentiated to determine correct reimbursement. Question 21. Ms. Cruz, a Medicare beneficiary, receives a bilateral pneumatic compression device for treatment of chronic lymphedema in both legs. The physician also provides education on device usage. What is the appropriate HCPCS level II code? A. E651, B. E650, C. E652, D. A6549. Correct answer, C. E652. Explanation: E652 describes a pneumatic compression device with calibrated gradient pressure for bilateral use. E651 is for a single extremity. Modifier usage is not needed unless coverage or pricing adjustments are required. According to Medicare coverage policies, devices for chronic lymphedema are reimbursable with documentation of medical necessity. Question 22. What does modifier LT indicate in HCPCS level II coding? A. Injection to the left arm, B. Procedure on the left side of the body, C. Use of lower extremity, D. Limited time procedure. Correct answer, B. Procedure on the left side of the body. Explanation: Modifier LT is used to specify procedures performed on the left side of the body, e.g., left eye, arm, leg. It is informational and often required for durable medical equipment or surgical coding. Documentation must clearly reflect laterality to support the use of LT or RT modifiers. Question 23. A patient receives a single dose of leuprolide acetate injection, 7.5 mg. Which HCPCS code should be used? A. J1950, B. J9217, C. J1955, D. J3315. Correct answer, A. J1950. Explanation: J1950 is for leuprolide acetate for depot suspension per 3.75 mg. So for a 7.5 mg dose, 2 units would be billed. J9217 is for leuprolide acetate injection per 1 mg, which applies to non-depot forms. Always refer to the drug package insert and HCPCS code description for accurate unit billing. Question 24. Dr. Mitchell administers a Prolia injection, denosumab 60 mg, to Mr. Harris in the outpatient clinic for osteoporosis. The provider documents both the administration and the medication supply. What HCPCS code should be reported for the drug? A. J897, B. J896, C. J3487, D. J1170. Correct answer, A. J897. Explanation: J897 is used for denosumab, 1 mg. Therefore, 60 units should be reported for a 60 mg dose. HCPCS level II codes are used to report the supply of drugs and biologicals. The administration code, CPT 96372, is reported separately. Question 25. Which code best represents crutches underarm type, both standard and adjustable? A. E110, B. E111, C. E112, D. E114. Correct answer, D. E114. Explanation: E114 covers crutches, underarm other than wood, adjustable or fixed pair. This code includes both adjustability and the pair. Codes E110, E113 refer to other variations like single crutches or wooden material. Question 26. A Medicare patient receives a nebulizer machine and accessories for home use to treat asthma. Which code applies? A. E570, B. E565, C. E605, D. E580. Correct answer, A. E570. Explanation: E570 is the code for nebulizer with compressor. It is a covered DME item when medically necessary and prescribed for respiratory conditions. Per CMS coverage guidelines, the diagnosis must support medical necessity. Question 27. Mr. Nash is fitted with a prosthetic lower limb following a below-knee amputation. The prosthetist bills for a below-knee socket replacement with locking mechanism. What HCPCS code should be reported? A. L5673, B. L5620, C. L5679, D. L5654. Correct answer, A. L5673. Explanation: L5673 describes a socket replacement for below-knee prosthesis with locking mechanism. L codes are used for orthotic and prosthetic devices. Accurate documentation of component type is required for proper reimbursement under DMEPOS. Question 28. Which HCPCS modifier indicates that a service is provided under arrangement by another provider? A. QJ, B. QK, C. Q5, D. Q1. Correct answer, A. QJ. Explanation: QJ indicates services provided to a prisoner or state federal institution patient under arrangement. This modifier is typically used in facilities billing for services rendered by contracted providers. Question 29. Which of the following codes represents a glucose monitor supply used daily with calibration capability? A. A4232, B. A4233, C. A4236, D. A9276. Correct answer, D. A9276. Explanation: A9276 is for sensor, invasive AG, subcutaneous, disposable for use with interstitial continuous glucose monitoring system. This is a supply code often used for CGM, continuous glucose monitoring, devices. Question 30. What HCPCS level II code represents the administration of a COVID-19 vaccine, intramuscular, mRNA-based, dose 1? A. 91300, B. 1A, C. M201, D. 91301. Correct answer, B. 1A. Explanation: 1A is the administration code for the first dose of the Pfizer-BioNTech COVID-19 vaccine. 91300 is the vaccine product code. Always report both the vaccine product and administration separately per CMS and CDC guidelines.